Hi everybody, let's talk about osteoporosis and hopefully how to prevent it. So many of my patients have developed osteoporosis and I've had extensive talks with them about what we can do to avoid it. So let's talk about that today. This is Dr. Levi, orthopedic surgeon here in Los Angeles. When it comes to your bone health, as women get older, often there is a significant amount of bone density loss because of age and after menopause, of course. So what are things that you can do to help minimize your bone loss? Let's talk about it. First, make sure that your diet has an appropriate amount of calcium as well as vitamin D. Make sure that you have access to sunlight, where you're going out and getting free vitamin D by being out in sunlight in a reasonable amount of time, of course. And if you're in the sunlight, be sure to use sunscreen, sun protective agents, of course. Then, exercise. Weight-bearing exercises are really, really important, especially pre- and postmenopausal. It's important that you exercise with weights. Now, that can be using weights like this, for example, do bicep curls, tricep curls, kickbacks. All those things are great. One thing I also recommend is that if you're walking or running, that you get a weight vest, a 5-pound weight vest, a 10-pound weight vest, even a 15-pound weight vest to really challenge yourself when you're walking. But doing squats with the weights, doing lunges with weights, weight-bearing exercise will basically kick your bones into gear so that they can get stronger and hopefully minimize your risk for developing osteoporosis or some form of osteopenia. Now, with weight-bearing exercises, sunlight, vitamin D, calcium in your diet, the other part is hormone replacement therapy. This is very controversial in the medical community. So when it comes to hormone replacement therapy, HRT, it's important that you're under the supervision of a medical professional, because this really has to be balanced out, it has to be monitored, and you really have to be appropriately checked and blood work done also. So those are my thoughts about hormone replacement therapy. Now, with that said, I hope you exercise, eat well, get appropriate sunlight. Again, modify your diet to fruits, nuts, healthy grains, leafy green vegetables. And also, the other thing we have to talk about when it comes to osteoporosis is minimizing alcohol in your diet. There is no safe amount of alcohol that anyone can tell you to drink. So minimize alcohol, and of course to not smoke, because alcohol and smoking can definitely help to increase your risks for developing osteoporosis. So I hope this has been very helpful. I really appreciate all your questions, and hopefully the ones that we curate and we answer, I hope that these are beneficial for you. This is Dr. Levi talking today about osteoporosis and most importantly, how to prevent it.